Sunburn is caused by overexposure to the sun, a sun lamp, or overexposure to radioactivity, although this is extremely rare. We can avoid overexposure by covering the skin with clothing and wearing sun cream. If you think somebody may have been sunburnt, there are 3 things to look for: reddening of the skin, pain in the area that's been burnt, and blisters. Encourage them to take sips of cold water, cool the area down by sponging them with cool water, or soak the sore skin in a bath or a shower for no longer than 10 minutes. You can repeat this if it helps ease the pain. If the burn doesn't blister, then the sunburn is mild and you can treat with calamine lotion or after sun to soothe the sore skin. If there are blisters or other skin damage, then the burn is severe and they will need to see a doctor. You will also need to look out for symptoms of heat stroke and heat exhaustion, as these can be life-threatening. Remember, cover the skin, take sips of cold water, cool the skin. If there's no blistering, then use calamine lotion or after sun. If there is blistering, seek medical advice. And that's how we treat somebody who's suffering from sunburn.
Dehydration occurs when the amount of fluids lost from the body is not adequately replaced. It is mainly the result of excessive sweating through sporting activity, hot temperature or fever, but can be caused by diarrhea and vomiting. There are 4 signs of dehydration to look for: headaches and lightheadedness, dry mouth, eyes and lips, small amounts of dark urine, muscle cramps. If someone is dehydrated, help them to sit down and give them plenty of water to drink. Giving them an oral rehydration solution to drink will help replace the salt and other minerals which they've lost. You can buy rehydration sachets from the pharmacy. If they have any painful cramps, encourage them to rest and then help them stretch and massage the muscles that hurt. Keep checking how they're feeling. If they still feel unwell once they're rehydrated, then encourage them to see a doctor straight away. So remember, when you're treating dehydration, help them to sit down, give them water, give them an oral rehydration solution, encourage them to see a doctor if it doesn't go away. And that's how we treat dehydration.
If after performing the primary survey, you find someone who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand center on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing "Staying Alive." After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there's someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally, again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask a caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk if you found someone collapsed. The initial assessment is called a primary survey. This is a quick, early assessment to establish how best to treat a casualty in order of priority. We can use the initials Dr. ABC or DRABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. So, when I see a casualty, first, I'm going to check for any danger to make sure it's safe for me to approach them. I don't want to become a casualty myself. Then I'm going to see if I can get a response from the casualty. As you approach, introduce yourself. Ask them questions to try to get a response. If they're not alert and do not respond to your voice, kneel down beside them and gently shake their shoulders. Hello, Amy. It's Winston. Can you hear me? Open your eyes. Still no response? You can pinch their earlobe to see if they respond to pain. Depending on how the casualty responds to you, will establish a level of response. We use the AVPU scale, and each letter can represent the casualty's level of response. A. Alert. V. Response to voice. P. Response to pain. And U is the casualty unresponsive to stimuli. If there's still no response, they are unresponsive. We need to check the airway. Is the casualty alert and speaking to you? You know that there's no problem with the airway. It is clear. If the casualty is unresponsive, open the airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Now we need to check to see if they are breathing normally. We do this by placing our ear and cheek over their nose and mouth, looking down the body to see if the chest rises and falls. We do this for 10 seconds. If the casualty is not breathing normally, call for help. Ask them to call 999 or 112 for emergency help and bring an AED. If you are alone, call for emergency help using a mobile on speakerphone and begin CPR with chest compressions. The casualty is breathing normally, so I'm going to check their circulation. Are there any signs of severe bleeding? Look and check down the body. If you find severe bleeding, try to control the bleeding to prevent life-threatening shock. Call 999 or 112 for emergency help before continuing to treat the casualty. You may also need to treat them for shock. I've established that my casualty is not bleeding. So remember, to do a primary survey, follow the order of Dr. ABC. Complete each step in that order as quickly as possible, dealing with any life-threatening conditions as you find them. call for emergency help. Call 999 or 112. And that's how we perform a primary survey. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
If you ever find your baby is not responding to you, you will give them the best chance of survival if you know what to do. If you have found your baby unresponsive and not breathing normally, you will need to perform baby CPR. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs covering both the nose and mouth, then 30 chest pumps with 2 fingers to the centre of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you do baby CPR. Thanks for watching. Help support St John Ambulance. Donate today.
You should use a sling to stop someone's arm moving to protect it and prevent further damage. There are 2 types of sling, an arm sling and an elevation sling, and both can be made using a triangular bandage. The difference between these 2 types of sling is that an arm sling holds the arm in a horizontal or slightly raised position. It treats upper arm injuries, wrist injuries, somebody who can bend their elbow, and also for a rib fracture. An elevation sling holds the arm in a raised position with the fingertips touching the shoulder. It can help support the arm. It can also help control bleeding from the hand or the arm and also help to reduce swelling. To make an arm sling, ask the casualty to support their arm. If you just hold it for me. And then use your triangular bandage and gently pass it underneath their arm and over their shoulder. And leave the long bit facing down. Then bring the top bit around to the opposite shoulder, and the bit that's hanging down, bring that up to beat it. If you just let go of your arm for me now, and then re-support it. Lovely. Just tie a reef knot. And then tuck the corners underneath. And make sure the whole of the arm is supported, down to the little finger. With the bit that's left over, just twist it until it becomes nice and tight and it snugly fits in around the elbow. To make an elevation sling, first ask the casualty to support their injured arm. You just support it there for me, and their fingertips should be touching the shoulder. Lay your triangular bandage over the injured arm. Just get the casualty to hold it in place. Just hold it there for me. Come underneath the arm, around the back, and then tie using a reef knot. And then just tuck the points under. With the bit that's left over, just twist it until it's nice and tight and it fits snugly in by the elbow. To check circulation, you need to squeeze the fingernail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the sling is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, there are 2 types of sling. You need to know which one to use for each condition and how to apply them.
When there's something wrong with your baby, if you know what to do, you'll give them the best chance of survival. If you've found your baby is not responding to you, you'll need to do a primary survey. If they are breathing, try to keep calm and put them into the recovery position. This is the safest position for your baby until help arrives. Cradle your baby in your arms with their head tilted downwards. Then call for an ambulance. Keep checking your child's breathing, pulse and level of response while you wait for help to arrive. And that's how you put a baby in the recovery position. Thanks for watching. Help support St John Ambulance. Donate today.
Shock happens when the important organs in the body, such as the heart and brain, don't get enough blood or oxygen. Your baby can suffer from shock if they've lost a lot of bodily fluids. This could be from diarrhoea, vomiting, burns or dehydration. Your baby may also suffer shock if they have had a severe allergic reaction, a severe infection, or if they are bleeding heavily. If your baby is in shock, you might see some of these signs. They may look pale and unwell. Their skin may be cold and clammy. Their breathing may be fast and shallow. They may not be feeding or urinating. They may make a grunting noise when they breathe, or they may yawn or sigh a lot. They may appear confused and not respond as normal. In severe cases, they may become unresponsive. If you think your baby is in shock, call 999 or 112 for an ambulance. Explain that your child is in shock and what you think caused it, such as bleeding, diarrhoea, vomiting or an allergic reaction. Lay your baby down with their legs raised higher than their chest. Support the legs on something like a cushion or a rolled up blanket. Do not leave your baby on their own. Loosen any tight clothing around their neck, chest and waist. Keep your baby comfortable and calm, as fear or pain can make shock worse. Keep checking your baby's breathing and pulse and whether they can respond to you. If they become unresponsive at any point, open their airway, check their breathing and prepare to do CPR if necessary. So remember, call 999 or 112 for an ambulance. Keep your baby's legs raised above their chest. Keep them calm and comfortable. Keep checking their breathing. And that's how you treat a baby for shock. Thanks for watching. Help support St John Ambulance. Donate today.
Cracking a bone is called a fracture. A broken bone that does not puncture the skin is called a closed fracture. But sometimes a bone can puncture the skin. This is called an open fracture. Even if you can't see any blood, the break will have caused some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bones, are supple and can split, crack or bend quite easily, a bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They may have difficulty moving and have movement in an unnatural direction. The limb may look shorter, twisted or bent. There may be a grating noise or feeling if the limb is moved, have loss of strength, or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area. Use a sling or triangular bandage to keep it secure. Cover any wounds. Call 999 or 112. And that's how you treat someone with a fracture. If this video has been helpful to you, help support St John Ambulance by going to sjA.org.uk.
In an asthma attack, the muscles of the air passages in the lungs go into spasm. This makes the area narrower, making it difficult to breathe. This can be triggered by an allergy, a cold, or smoke. At other times, someone may have a sudden attack with no obvious trigger. If you think someone is having an asthma attack, there are 5 things you may see. They may have difficulty breathing or speaking. They may be wheezing. They may be coughing a lot. They may be distressed, anxious. They may have a grey-blue tinge to their lips, the earlobes, or the nail beds. People with asthma usually know how to deal with their own attacks by using their reliever inhaler, usually with a blue cap at the first sign of the attack. But if they don't, or if the attack is severe, you may need to help. When treating someone having an asthma attack, keep calm. Reassure them and advise them to use their reliever inhaler straight away. Advise them to use a spacer if they have one. Amy, use a spacer with the inhaler. Yes. Yeah, well done, well done. Ask them to breathe slowly and deeply to help control their breathing. Sit them down in a comfortable position. If it doesn't get any better within a few minutes, it may be a severe attack. Get them to take 1 or 2 puffs of the inhaler every 2 minutes until they've had 10 puffs. If this is their first attack, the attack is severe, they're not getting better, they're getting worse, or they become exhausted, call 999 or 112 for emergency help. Help them to continue to use the inhaler as needed. Keep checking their breathing, pulse, and level of response. If they do become unresponsive at any time, treat a casualty who is unresponsive. So remember, reassure them. Help them to use their reliever inhaler. If the attack is severe, call 999 or 112 for emergency help and monitor their level of response. If they become unresponsive, treat as an unresponsive casualty. And that's how we help someone with an asthma attack. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate. Eye injuries vary from something very minor, such as getting shampoo in your eye, to something quite serious, such as a cut, which could cause permanent loss of vision. Common types of eye injuries include foreign objects getting stuck in the eye, cuts or grazes from a sharp object, severe blows to the eye from a hard object. If you think someone's hurt the eye, there are 5 key things to look for. Pain in the eye or eyelid, a visible wound or bloodshot appearance, partial or total loss of vision, blood or clear fluid leaking from the wound, screwed up eyelids and watering if there is something in there. If someone has an eye injury, tell them not to rub the eyes as this can make it worse. Get them to sit down facing a light. We're going to open the eyelid. Get them to look right, left, down, and back. If you see something in the eye, get them to tilt to the injured side. You can use a jug of water or saline solution to remove the object. You can use a tea towel to get any drips that may come from the eye. If you think the eye may be bruised or cut, get them to lie on their back, keeping their head and eye as still as possible. You can give them a non-fluffy sterile dressing to hold in place over the eye. Mark, could I get you to just place this over the eye for me? Excellent. Or you can keep it in place with a bandage. Then take or send him to hospital. So remember, when you're treating eye injuries, tell them not to rub the eyes. Look closely to see if there's anything in the eye. If there's something in it, wash it up with clean water. Put a pad on the eye if it's bruised or cut, and take or send him to hospital. And that's how you treat them.
If you think someone has a fever, there are 6 key points to look for. To start with, high temperature above 37 degrees Celsius, pale skin. They may feel cold with goose pimples, shivering with chattering teeth. Later on, hot flush skin and sweating, headache and general aches and pains. Take their temperature using a thermometer. If it's above 37 degrees Celsius, it's a fever. Give them plenty of cool drinks to replace any fluids they lose from sweating. If they are feeling unwell, you can give the recommended dose of paracetamol. But remember, don't give any aspirin-based product to anybody under the age of 16. If you are worried about their condition, then call their doctor's surgery for some advice. If their temperature is above 39 degrees Celsius, then call their doctor or the NHS advice line. If their condition worsens, then call for an ambulance immediately, and if it's a child, be prepared to treat them for a seizure. Remember, check their temperature, keep them cool, give plenty of cool drinks. If their temperature is over 39 degrees Celsius, seek medical advice, and if their condition worsens, call for an ambulance. That's how we treat a fever.
Frostbite happens when parts of the skin and other tissues freeze due to low temperatures. It usually happens to parts of the body furthest from the heart, like fingers and toes. Frostbite usually happens in freezing or cold and windy weather. People who cannot move around are more likely to get it. Someone with frostbite will probably have hypothermia, so be prepared to treat them for hypothermia too. There are 4 signs to look for. Pins and needles to begin with, paleness followed by numbness, hardening and stiffening of the skin, change in skin colour, first white, then blotchy and blue. If someone has frostbite, encourage them to put their hands in their armpits, then help move them indoors or somewhere warm. Then gently remove any constricting items like rings, gloves or boots. Also remember to keep them warm. Next, warm the body part with your hands on your lap or under the armpits. Don't rub because it could damage the skin tissue. But if there's a danger of it refreezing, don't warm it up yet as it could cause more damage. Place the body part in warm but not hot water that's around 40 degrees centigrade. That's 104 Fahrenheit. And be careful not to put it near direct heat as this could cause more damage. Dry it carefully and put on a light dressing, ideally gauze pad from your first aid kit. Once you've done that, help them to raise their limb to reduce swelling. You could use a cushion or sling. You can give them some painkillers for the pain, then take or send them to hospital, but make sure their affected limb is raised. So remember, when treating someone with frostbite, put their hands in their armpits, remove restricting clothing, warm the body part with your hands, use warm water but not hot water to warm the affected limb, put on a light dressing, give them painkillers caused by loss of salt and water from the body, usually through excessive sweating. It develops slowly and usually happens to people who aren't used to hot, humid weather. A dangerous and common cause of heat exhaustion is when the body produces more heat than it can cope with. This can happen when someone takes non-prescription drugs, like ecstasy, which can stop the body from regulating its temperature properly. There are 6 key things that may lead you to suspect someone has heat exhaustion: a headache, dizziness and confusion, a loss of appetite and feeling sick, sweating with pale, clammy skin, cramps in the arms, legs and stomach, and fast, weakening pulse and breathing. If you think someone is suffering from heat exhaustion, help the person to a cool place and get them to lie down with their legs raised. Give them lots of water to drink, and you can also give them an isotonic drink to help replace the salt in the fluid that they have lost through sweating. Keep checking their level of response. If their condition seems to be getting worse, place them into the recovery position and call 999 or 112 for emergency help. So remember, help them lie down in a cool place, raise their legs and give them water to drink. And that's how you treat someone with heat exhaustion. If this video has been helpful to you, help support St John Ambulance by going to sjA.org.uk/.
Heat rash or prickly heat is an itchy rash of small red spots that can cause a stinging or prickling feeling on the skin. The rash can be anywhere on the body, but usually people get it on their face, their chest, back and thighs. It is caused by sweat glands becoming blocked, so people usually get the rash if they're sweating more than usual. Heat rash isn't serious. It will usually go away after a few days, so it doesn't normally need medical attention. There are 4 signs of heat rash to look for: itching, a rash of tiny red spots, mild swelling, and a prickling or burning feeling. If someone has heat rash, you should explain that the rash is not serious, but give them tips on how to soothe the itching and avoid getting the heat rash in the future. You can suggest to take a cold bath or shower to cool the skin and help prevent further sweating. They can also buy calamine lotion or hydrocortisone cream, which will help to soothe the itching. Recommend that they wear loose clothing made of cotton, as cotton doesn't trap heat as much as synthetic fibers like nylon and polyester. Tell them to drink plenty of water to stop them getting dehydrated, and suggest they avoid excessive heat or humidity by staying out of the sun and not sitting too close to a fire or heater. So remember, when treating heat rash, suggest a cold bath or shower, use calamine lotion, suggest loose clothing, and drink plenty of water. And that's how you treat heat rash.
Stroke is caused by the failure of the thermostat in the brain, which regulates the body's temperature. If someone has a high fever or has been in the heat for a long period of time, the body can become dangerously overheated. Heat stroke can develop from someone who is already suffering from heat exhaustion. Heat stroke can develop quickly with little warning, and the casualty could become unresponsive within a few minutes. Our priority is to try and cool them down as quickly as possible and get them to hospital, as this can be life-threatening. If someone has heat stroke, you may see some of the following signs: hot, flushed and dry skin, restlessness and confusion, a headache, dizziness or discomfort, a bounding pulse and high temperature above 40 degrees, or their level of response may decrease rapidly. If someone has heat stroke, move them to a cool area quickly and remove their outer clothing where possible. Call 999 or 112 for emergency help. Help sit them down and wrap them in a cold, wet sheet. Pour water on the sheet to keep it wet until their temperature falls below 37.5 degrees. You can measure this with a thermometer under the armpit. If there's no sheet, you could sponge them with cold water or fan them to keep them cool. When their temperature returns to normal, replace the wet sheet with a dry sheet. While waiting for help to arrive, monitor their level of response. If their temperature starts to rise again, repeat the process to try and cool them down. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, when treating heat stroke, move them to a cool place and remove clothing where possible. Call 999 or 112 for emergency help. Wrap them in a cold, wet sheet until their temperature drops, and monitor their level of response. And that's how you treat someone with heat stroke. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk.
Hyperventilating is excessive breathing. It's normally caused by extreme anxiety and can happen at the same time as a panic attack. When someone is hyperventilating, they breathe unnaturally fast and deep, which can make them lose more carbon dioxide from their blood than usual. This can make them feel dizzy and weak. When they start to breathe normally again, they should feel better. There are 6 signs to look for if you think someone is hyperventilating. Unnatural, fast, deep breathing. Anxiety or attention-seeking behaviour. Feeling dizzy or faint. Trembling or tingling in the hands or feet. And muscle cramps in the hands or feet. If someone is hyperventilating, talk to them and reassure them. Try to take them somewhere quiet. This will help them to control their breathing. If that's not possible, ask any surrounding people to leave or turn away. Once they have controlled their breathing, advise them to see a doctor as to how they can prevent and control hyperventilation in the future. If you are concerned about their symptoms or if their breathing does not get any better, call for an ambulance. So remember, if someone is hyperventilating, take them somewhere quiet. Ask other people to turn away or leave and encourage them to see a doctor.
Your priority is to control the bleed and keep the airway open. Help them to sit down, never lie down, and keep the nose above the heart to help to control the bleeding. Get them to lean forward, never backwards. This ensures that the blood drains out through the nose rather than the back of the throat, which may block the airway. Ask the casualty to breathe through their mouth and pinch the soft part of the nose. You can give them a pad to catch any blood that may drain out. After 10 minutes, release the pressure, reassess. If the bleeding has not stopped, apply the pressure for a further 10 minutes. If the bleeding is severe, or if you have not managed to control the bleed after 30 minutes, it is time to call for an ambulance. So remember, get them to sit down leaning forward, pinch the soft part of the nose, and if necessary, call for an ambulance. And that's how you treat a nosebleed.
Poisons could include chemicals, drugs, plants, fungi, and berries. There are 5 key signs to look for if someone has swallowed a poison. They may have nausea and vomiting, which can sometimes be blood-stained, cramping abdominal pain, a burning sensation. They may show a decreased level of responsiveness, or even have a seizure. If someone has swallowed a poison and they are responsive, ask them, "What have you swallowed? How much did you swallow? And when did you swallow it?" Look for clues such as poisonous plants or empty packaging. Reassure them and call 999 or 112 for emergency help. Give ambulance control as much information as you can about the poison, as it will help to treat the casualty. While waiting for help, monitor their level of response and keep reassuring them. If the poison they've swallowed has burnt their lips or airway, give them sips of water or milk. If they should vomit, try to keep a sample in a bag or container to give to the ambulance personnel. It may help them to identify the poison. Do not try to make them vomit. If they become unresponsive at any time, be prepared to treat an unresponsive casualty. So remember, when treating someone who has swallowed a poison, ask them what they have swallowed, how much and at what time. Look for any clues. Call 999 or 112 for emergency help. While waiting for help, reassure the casualty and monitor their level of response. And that's how you can help someone who has swallowed a poison. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk.
It can be traumatic and distressing. If someone's bleeding isn't controlled quickly, They may develop a life-threatening condition called shock, and they may become unresponsive. Bleeding from the mouth or nose may affect their breathing. So try to ensure that the airway is kept clear. An obstructed airway can be a cause for a casualty to become unresponsive. If the casualty becomes unresponsive at any point, open the airway and check their breathing and prepare to treat an unresponsive casualty. To treat someone with a severe bleed, put gloves on if you have them, as this will help to protect you both from infection. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it in and apply pressure on either side of it to push the edges together. If there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Jenny, can you apply some pressure for me, please? Brilliant, excellent, well done. Ask a helper to call 999 or 112 for emergency help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. The casualty may develop shock, so help them to lie down on a blanket or rug if there's one to protect them from the cold. Raise and support their legs so they are above the level of their heart. Do not raise the leg if it is injured. Jenny, could I lay you down? Excellent. Just going to lift your legs up. Is that okay? Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. So just going to apply this dressing to the feet. Okay. Want to take your hand away? Well done. Okay. Can you hold up for me? Excellent. Okay, can I have this? Okay. Check the circulation by pressing a nail bed or skin beyond the bandage for 5 seconds. Release the pressure. And if the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. Okay, can I have this? Okay. If blood shows through both dressings, remove them and apply a fresh bandage, ensuring there is direct pressure applied at the point of bleeding. Support the injured part with a sling or bandage, but check circulation every 10 minutes. Keep monitoring the casualty's level of response while waiting for help to arrive. So remember, when treating severe bleeding, wear gloves if available. Remove or cut away any clothing from around the wound. Check for objects in the wound, but don't remove them. Apply pressure on either side of the wound. If there is no object in the wound, use a dressing or pad and apply direct pressure to the wound. Call 999 or 112 for emergency help. Secure the dressing with a bandage. Treat the casualty for shock. Support the injured area. Keep checking their level of response while waiting for help. And that's how we treat someone with a severe bleed. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
Shock is a serious life-threatening condition that happens when vital organs in the body are not getting enough blood flow, and this can lead to failure of these organs and the heart. Shock can be caused by anything that reduces the circulation or blood flow, such as severe bleeding, which you may be able to see, or it may be hidden and internal. If the heart is unable to pump blood around the body after problems like a heart attack, severe heart disease, or heart failure. Loss of bodily fluid following severe vomiting, diarrhea, or severe burns. After a severe allergic reaction or severe infection. and following a spinal cord injury. These conditions may all lead to life-threatening shock. When someone is in shock, they may have a fast pulse, pale, cold or clammy skin, sweating, fast, shallow breathing, grey-blue skin, especially inside the lips, weakness and dizziness, nausea and possible vomiting, thirst. As the shock becomes more severe, they may have a weak pulse that you may not be able to feel, restless and aggressive behaviour, gasping for air, they may become unresponsive. To treat for shock, you need to try to reverse the cause of shock. If you find severe bleeding or serious burns, try to treat these whilst reassuring the casualty. Help the casualty to lie down. If possible, try to lie them down on a rug or blanket, as this will help protect them from the cold. Raise and support their legs above the level of their heart, as this will increase blood flow to the head and vital organs. But if the casualty has an injured leg, do not raise it. If the casualty is pregnant, help them to lie with their body leaning towards their left side to prevent obstruction of blood flow returning to the heart. If you haven't done so already, call 999 or 112 and tell ambulance control that you suspect shock. Once you have called for emergency help, you can then loosen any tight clothing around their neck, chest and waist. Stay with the casualty and keep them warm by covering them with a blanket or coats. Try to reassure them and keep them calm. Keep monitoring their level of response. If they become unresponsive, open their airway, check their breathing and prepare to treat someone who is unresponsive. So remember, if you think someone is in shock, treat the cause of shock. Lay them down and raise their legs. Call 999 or 112 for emergency help. Loosen any tight clothing and keep them warm and calm. Monitor their level of response. And that's how we treat shock. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
An AED is a life-saving device that can give your heart an electric shock when it has stopped in a cardiac arrest. AED is short for Automated External Defibrillator. An AED can be used on adults and children over 1 year old. Using an AED in crucial minutes before an ambulance arrives can increase someone's chance of survival. Anyone can use an AED. You don't need to be worried about getting it wrong or causing harm because the machine analyzes the casualty's heart's rhythm and then gives visual or voice prompts to guide you through each step. If someone is unresponsive and not breathing normally, ask someone to call 999 or 112 for emergency help. Ask them to bring an AED if one is available. If you're alone, make the emergency call yourself on a mobile phone or speakerphone and start CPR with chest compressions. Do not leave the casualty to look for an AED. Keep doing CPR until someone brings an AED. As soon as the AED arrives, ask for it to be switched on while CPR is continued. It will immediately start to give you a series of visual and verbal prompts informing you of what needs to be done. If someone is with you, ask them to follow the instructions until emergency help arrives.
Call for help now. Remove all clothing from patient's chest. Pull red handle to open bag. Look at pictures on pads. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Evaluating heart rhythm.
Stop compression, Susan. Stand back.
Stand by.
Stand clear, everyone.
Shock. Everyone clear. Do not touch patient.
Stand back.
Delivering shock. Shock delivered. Provide chest compressions and rescue breaths.
The AED will instruct you to continue CPR for 2 minutes before it reanalyzes. The AED could say no shock advised, continue CPR. If the casualty shows signs of becoming responsive, place them in the recovery position. Leave the AED attached. Continue to follow the voice and/or visual prompts that the machine gives you until help arrives. So remember, when using an AED, call 999 or 112 for emergency help. Continue giving CPR when the AED arrives and keeps going when the pads are applied, if possible. Ensure that the pads are placed on the chest after clothing has been cleared or cut away. Ask for the AED to be switched on and follow the instructions. Ask people to stand back when the AED is analyzing and when any shocks are being delivered. And that's how you use an AED. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
In an emergency situation, you may need to act quickly, so it's important that you're familiar with your first aid kit to know what to use for different injuries. All workplaces, leisure centres, homes and cars should have a first aid kit. Plasters for small cuts and grazes. A wound dressing is a sterile pad attached to a bandage. They're for larger cuts to apply pressure and stop the bleeding. They're easy and quick to apply in an emergency. Roller bandages are long, thin bandages rolled up. They're used to hold dressings in place, to apply pressure and stop bleeding. You can also use them to hold ice packs in place to reduce the swelling. A triangular bandage is a large triangular-shaped piece of cloth. It can be used as a bandage. Also, it can be used as a dressing if it's sterile, to cover a large wound or burn. Disposable gloves reduce the risk of infection between you and the casualty. Always wear them if you have them when dressing a wound. Also use them when dealing with any bodily fluid or waste. Face shields or pocket masks can be used to reduce infection when giving rescue breaths. Alcohol-free cleansing wipes are used to clean the skin around the wound. Gauze swabs can be used as dressings, padding, or swabs to clean around the wound. Sticky or adhesive tape is used to hold dressings in place or to secure the loose ends of bandages. Scissors are used to cut somebody's clothing so that you can get to the wound. They can also be used to cut sticky tape to the required length. Some other common items that might be useful are cling film or clean plastic bags for dressing burns and scalds. Use alcohol gel to clean your hands if you don't have any water. A blanket, survival bag, torch and whistle are useful for helping people outdoors. A warning triangle and a high visibility jacket are useful in the car for dealing with road accidents. So remember, make sure you have a first aid kit and make sure you know how to use it. Out of its usual position. Injuries of this type include a pulled elbow. This can happen if an arm is pulled with too much force, when pulling your baby up by the hands or pulling an arm through a sleeve while dressing. If your baby has a dislocated joint, you might see some of these signs. They may have pain in the area. They may not be able to move the joint as usual. The area might be bruised or swollen or look misshapen. If you think your baby has a dislocated joint, try to keep them still. Don't try to put the dislocated bone back into its socket, as this can cause further injury. Steady and support the limb and use padding to keep the injury supported. Call 999 or 112 for emergency help, or take the baby to see a doctor or nurse or to hospital. Treat them for shock if necessary. While you wait for the ambulance, check your baby's breathing, pulse and whether they can respond to you. So remember, keep your baby still. Don't try to put the joint back into the right place. Pad and support the injury. Call 999 or 112. Keep checking pulse and breathing while waiting for the ambulance. And that's how you treat a baby with a dislocated joint. Thanks for watching. Help support St. John Ambulance. Donate. Babies and toddlers can push objects into their ears or nose quite often, and sometimes insects may fly or crawl into the ear. If they have an object lodged in their ear or nose, do not try to remove it yourself, as you may push it in further or cause injury. If there is an object stuck in your baby's ear, take your baby to hospital as soon as possible. Keep reassuring them. If you think they have an insect in the ear, you could try to help it out by sitting them down and supporting their head with the affected ear facing up. Gently pour some tepid water into the ear and the insect should float out. If it doesn't, seek medical help. If there is an object stuck in the nose, try to keep calm. If possible, get them to breathe through their mouth and stop them from poking their nose. Take them to hospital so that the object can be safely removed. So remember, if your baby has something stuck in their ear or nose, don't try to remove the object yourself. Take them to hospital as soon as possible and help them to stay calm. If the object is stuck in their nose, encourage them to breathe through their mouth and don't let them poke their nose. If they have an insect in the ear, you could use warm water to try and flood it out. And that's how you treat a baby with an object in their ear or nose. Thanks for watching. Help support St John Ambulance. Donate today. Although it can be very worrying to see your baby having a seizure, if it is dealt with properly, it is rarely dangerous. Your baby may have a seizure if they have a high temperature, which is sometimes caused by an infection. The electrical systems in a baby's brain are not developed enough to cope with a high temperature, and that is why they are more likely to have seizures. If your baby is having a seizure, you might see some of these signs. They may shake vigorously, arching their back and clenching their fists. They may have signs of fever, such as hot, flushed skin or sweating. Their face may twitch, and their eyes may be squinting, or fixed or upturned. They may hold their breath and dribble with a red, puffy face and neck. They may vomit. They may wet themselves or soil themselves. They may not respond to you as usual. If you think your baby is having a seizure, you need to protect them from hurting themselves. Don't hold them down or restrain them, and don't try to move them. Just clear away any dangerous objects and put pillows or soft padding around them. When the seizure has stopped, take off any clothing that isn't needed, but take care they don't get cold. Put your baby into the recovery position and call 999 or 112 for an ambulance. Reassure your baby and keep them calm. While you wait for the ambulance, check your baby's breathing, pulse and whether they can respond to you. So remember, don't move or restrain your baby. Remove dangerous objects nearby and protect your baby with soft padding. Take off excess clothing and place your baby in the recovery position. Call 999 or 112. Keep your baby calm and keep checking their pulse and breathing while waiting for the ambulance. And that's how we treat a baby who's having a seizure. Thanks for watching. Help support St John Ambulance. Donate today. Sometimes our bodies come into contact with things that can cause an allergic reaction, which may cause a rash or sneezing. These may be uncomfortable, but not life-threatening. However, a severe allergic reaction, which is also known as anaphylactic shock, can develop in seconds and needs to be treated quickly. Your baby may have a severe allergic reaction to some foods, such as nuts or animal hair, or even to some medicines. If your baby is having a severe allergic reaction, you might see some of these signs. They may get a red, itchy, raised rash. Their eyes may be itchy and watery. Their face or lips may swell up. They may vomit or have diarrhea. They may become wheezy or find it difficult to breathe. They may either be very pale or very flushed, and they may become very upset. If you think your baby is having a severe allergic reaction, you need to get help as soon as possible. Dial 999 or 112 straight away. Tell them that you think your baby is having a severe allergic reaction and what might have caused it. Sit your baby on your lap and lean them forward slightly to help their breathing while you're waiting for help. If you already know what your baby is allergic to and your doctor has prescribed medication to treat an allergic reaction, like an EpiPen, give them the medication in the usual way, like your doctor has told you. If you think they are in shock, lie them down and raise their legs. If your baby is unresponsive, if they are not moving or making a sound and they are not breathing normally, you will need to give them CPR. So remember, call 999 or 112. Give allergy medicine if you have it. Sit your baby on your lap and lean them forwards to help with their breathing. If your baby is unresponsive and not breathing normally, start CPR. And that's how we treat a baby with a severe allergic reaction. Thanks for watching. Help support St John Ambulance. Donate today. They could come into contact with poisonous substances. Poisonous things your baby might swallow include chemicals, drugs, plants, fungi and berries. If your baby has swallowed something poisonous, you might see some of these signs. They may vomit. They may have stomach pains. They may have seizures or fits. And they may become unresponsive. If you think your baby has swallowed something poisonous, try and find out what it is, how much they've swallowed, and when they swallowed it. Look for clues like plants or containers. Call 999 or 112 for an ambulance and give them all the information you can. While you wait for help, check that your baby is breathing normally and if they respond to you. If they do not respond, open their airway, check their breathing and see if they need CPR. Don't try to make your baby sick, but if they are, try and collect some of the vomit to give to the emergency services. It might help them to find out what the poison is. If what your baby has swallowed is burning their mouth or lips, give them sips of water or milk until help arrives. So remember, try and find out what your baby has swallowed. Call 999 or 112 for an ambulance. Keep checking their breathing. If your baby's mouth is burning, give them sips of water or milk until help arrives. And that's how you treat a baby who's swallowed a poison. Thanks for watching. Help support St John Ambulance. Donate.
Angina is a type of chest pain that someone gets when their arteries carrying blood to the heart muscle becomes narrowed. This restricts the blood supply to the heart and causes pain. This is called an angina attack. Angina attacks are usually brought on by physical exertion, stress, or excitement. But if someone has unstable angina, then the attacks can be unpredictable, with no obvious triggers. Angina on its own is not life-threatening, but someone who suffers from it is at far greater risk of having life-threatening problems like a heart attack or stroke. If they rest and take their own medication, the pain should only last a few minutes. If the pain lasts longer, then start treating them for a heart attack. If you think someone might be having an angina attack, there are 4 key signs to look for. Pain in the chest, which may spread to the jaw and arms, shortness of breath, sudden and extreme tiredness, and feelings of anxiety. If someone is having an angina attack, advise them to stop what they're doing and get them to rest in a comfortable position. If they have medication, they should take it. If the pain lasts more than 5 minutes, they can take a second dose. If they are still in pain after 15 minutes, then you should call for an ambulance. If they don't have any angina medications and the pain doesn't go away with rest, then call for an ambulance immediately. If the pain goes away completely within 15 minutes after rest or medication, they should usually be able to go back to what they were doing before the attack, if it's not too strenuous. If they're worried about the attack, they should seek medical advice. So, remember when someone is having an angina attack, help them to sit down and rest. Help them to take their medication if they have some and call an ambulance if they don't. If it doesn't get any better within 5 minutes, take a second dose. If it doesn't get any better after another 5 minutes, call for an ambulance.
That your casualty is unresponsive but breathing normally, they should be placed into the recovery position to help maintain the airway. To do this, kneel next to them on the floor. Remove their glasses and any bulky objects in their pockets, but do not search their pockets for small items. Make sure both of the casualty's legs are straight. Then take the arm nearest to you and place it at a right angle to the body with the palm facing upwards, like so. Take the other arm and bend across their chest and place the back of their hand against their cheek nearest to you and hold it there. With your other hand, lift their far knee up until their foot is flat on the floor. Whilst keeping the casualty's hand pressed against their cheek, pull on the far leg and carefully roll the casualty towards you and onto their side, like so. Once you've done this, adjust the top leg so that it is at a right angle. Tilt the casualty's head back so that the airway remains open. If needed, adjust the hand under the cheek to help to keep the airway open. If it has not already been done, call 999 or 112 for emergency help. Keep checking their level of response until help arrives. So remember, if the casualty stops breathing at any time, call 999 or 112 and prepare to give them CPR. And that's how you place someone in the recovery position. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
Can be caused by a disruption to the electrical activity in the brain, which may lead to uncontrollable contractions in muscles and unresponsiveness. If a seizure occurs, the most common cause is epilepsy, but it can be caused by other things, such as alcohol poisoning, a lack of oxygen, after a head injury, after taking certain drugs, or if someone with diabetes is having a hypo where the blood glucose is too low. When someone is having a seizure, you may find they have sudden loss of responsiveness, rigid body with arching back, noisy and difficult breathing, convulsive, jerky, uncontrolled movements, saliva at the mouth which could be blood-stained if they've bitten their tongue or cheek, possible loss of bladder or bowel control. Afterwards, they may be confused, tired, and fall into a deep sleep. If you suspect someone is having a seizure, it's important to protect them from harming themselves during the fit. Clear away any potential dangerous objects like hot drinks or sharp objects. Don't restrain or move them. Make a note of the time when the seizure started and how long it lasts. Protect their head by placing something soft underneath or around it, like a towel, and loosen any clothing around their neck. Once the seizure has stopped, open their airway and check their breathing. If they're breathing, put them into the recovery position. If they stop breathing at any point, prepare to treat someone who is unresponsive and not breathing, monitoring their level of response. Call 999 or 112 for emergency help if it's the person's first seizure, the cause is unknown, they're having repeated seizures, the seizure lasts more than 5 minutes, they are unresponsive for more than 10 minutes, or they've sustained an injury. So remember, protect, but don't restrain them. Call 999 or 112. And that's how you help someone who's having a seizure. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate. When the blood supply to the brain is disrupted and starves the brain of oxygen. Strokes are most commonly caused by a clot that blocks the flow of blood to a part of the brain, although some strokes can be caused by a ruptured blood vessel that causes bleeding into the brain. Call 999 or 112 for emergency help immediately if you think someone has had a stroke. If you suspect someone is having a stroke, you can use the FAST guide to identify the key signs. F stands for facial weakness. Look at their mouth or eye. They may be droopy and can't smile evenly. A. Arm weakness. Ask them to raise both their arms. They may only be able to raise one. Can you raise both arms for me, please? S. Speech problems. They're unable to speak clearly or might not be able to understand what you're saying to them. Ask them a question such as, "What is your name?" Can they respond appropriately? Can you tell me your name, please? T. It's time to call 999 or 112 for emergency help and tell them you suspect a stroke after using the FAST guide. While waiting for help to arrive, keep them comfortable, supported, and reassure them. Do not give them anything to eat or drink because it may be hard for them to swallow. Keep monitoring their level of response until help arrives. If they become unresponsive, prepare to treat for an unresponsive casualty. So remember, to help someone who has had a stroke, use FAST. Facial weakness, arm weakness, and speech problems means it's time to call 999 or 112 for emergency help. And that's how you help someone who's having a stroke. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate. Diabetes is a long-term medical condition where the body cannot produce enough insulin. Sometimes people who have diabetes may have a diabetic emergency where their blood sugar becomes either too high or too low. Both conditions are potentially serious and may need treatment in hospital. Hyperglycemia is where the blood sugar levels are high. It may be caused by a person with diabetes who has not had the correct dose of medication, may have eaten too much sugary or starchy food, or they may be unwell with an infection. A person with hypoglycemia may have a medical warning bracelet, warm, dry skin, a rapid pulse and breathing, fruity sweet breath, extreme thirst, or drowsiness leading to them becoming unresponsive if not treated. This is also known as a diabetic coma. Call 999 or 112 for emergency help and say you suspect hyperglycemia. While you wait for help to arrive, keep checking their level of response. If they become unresponsive at any point, open their airway, check their breathing, and prepare to treat an unresponsive casualty. Hypoglycemia is where the blood sugar levels are too low. It can be caused by an imbalance between the level of insulin and the level of glucose in the blood. If a person who is receiving treatment for diabetes misses a meal or takes part in a lot of exercise, their blood sugar level will fall. On rare occasions, low blood sugar levels can occur after binge drinking and after having a seizure or epileptic fit. People who suffer from diabetes may recognize when a hypoglycemic episode is coming on or starting and know that they need to eat something to bring their blood sugar level up. They may have their own blood testing kit to check their blood sugar level, but sometimes they may fail to recognize their symptoms in time, and without help, they may quickly become weak, confused, and unresponsive. A person with very low blood sugar, hypoglycemia, may have a medical warning bracelet, weakness, faintness, or hunger, confusion and show irrational behavior, sweating with cold, clammy skin, a rapid pulse, palpitations, trembling or shaking, or may be less responsive to you. If you suspect hypoglycemia, help the person to sit down. If they have their own glucose gel or glucose tablets, help them to take them. If not, you need to give them something sugary, such as a 150 milliliter glass of fruit juice or non-diet fizzy drink, 3 teaspoons of sugar or sugar lumps or sugary sweets, for example, 3 jelly babies. If they improve quickly, give them more of the sugary food or drink and let them rest. If they have their blood glucose testing kit with them, help them to use it, check their blood sugar level and stay with them until they feel completely better. If they do not improve quickly, look for any other reason why they're unwell and then call 999 or 112 for emergency help. Do not give them anything to eat or drink as they may choke. While waiting, keep checking their level of response. If they become unresponsive, open their airway, check their breathing, and prepare to treat an unresponsive casualty. So remember, if they have hyperglycemia, high blood sugar levels, call 999 or 112. If they have hypoglycemia, low blood sugar levels, and are alert, give them a 150 milliliter sugary drink or 3 jelly babies. Sit them down and let them rest. If you're unable to give them this and they don't improve quickly, call 999 or 112 for emergency help. And that's how you help somebody having a diabetic emergency. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
If someone has meningitis, they won't usually show all the signs and symptoms at the same time. The key points to look for are flu-like symptoms with a temperature, cold hands and feet, joint and limb pain, and blotchy or very pale skin. As the infection develops, there may be a severe headache, neck stiffness, drowsiness, vomiting, their eyes may become sensitive to light, and in a baby, there may be high-pitched moaning, a whimpering cry, floppiness, or a tense, bulging soft spot to the top of their head. If anybody shows the signs or symptoms of meningitis, like shielding their eyes from the light, then call for an ambulance immediately and treat the fever. Check to see if they have a rash. Most rashes will fade when you press the spots under the side of a glass. If the spots don't fade, call for an ambulance immediately. While waiting for an ambulance, reassure them and keep them cool. Be sure to check their level of response, pulse and breathing. Remember, call for an ambulance, check for a rash, keep them cool. That's how we treat somebody suffering from meningitis.
Crawling babies can get their fingers into all kinds of places in your home. If they put their fingers into electric sockets or appliances, such as hairdryers or phone chargers, it's possible for your baby to get an electric shock. This can be very serious. If your baby has had an electric shock, you might see some of these signs. They may have burns, blistered or charred skin. They may have pain or weakness. An electric shock can make your baby unresponsive. If you think your baby has had an electric shock, you'll need to do a baby primary survey. If your baby is still in contact with the electrical current, turn the power off if you can, or use something non-metallic to break the contact, like a rolled up magazine or a wooden spoon. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is breathing, put them into the recovery position. Cradle the baby in your arms with their head tilted downwards. If your baby has suffered an electric shock and has stopped breathing, you need to start baby CPR. This technique is for use on babies under 1 year old. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. You may also need to treat burns, move them away from the source of heat, cool the burn or scald by running it under cold water for at least 10 minutes. Don't use ice, gels or creams on the area. They can damage the affected skin and increase the risk of infection. Remove the clothing from around the burn. If the clothing is stuck to the skin, don't try to remove it. Cover the burn with cling film or a clean plastic bag. This protects it from infection. Serious burns or scalds need emergency treatment, so call 999 or 112. While you wait for the ambulance, treat your baby for shock if necessary. So remember, break contact with the electrical current with something non-metallic. Check if they're responding and breathing. If your baby is breathing, then put them into the recovery position and call for help. If your baby is not breathing, start baby CPR. You may also need to treat burns, so cool the burn with cold water, remove your baby's clothing unless it's stuck to the burn, and cover the burn with cling film or a clean plastic bag. And that's how you treat a baby who's been electrocuted. Thanks for watching. Help support St John Ambulance. Donate today. As your baby crawls or toddles around exploring the world, they may come into contact with something that can burn or scald them. A burn is usually caused by dry heat, like a flame or a fire, a hot iron or sunburn. A scald is caused by wet heat, like steam or a hot cup of tea. If your baby has a burn or scald, you might see some of these signs. They may cry or have pain in the area. They may have a reddened, swollen patch of skin. They may have blisters, or they may have peeling skin. If you think your baby has a burn or scald, move them away from the source of heat. Cool the burn or scald by running it under cold water for at least 10 minutes. Don't use ice, gels or creams on the area. They can damage the affected skin and increase the risk of infection. Remove the clothing from around the burn. If the clothing is stuck to the skin, don't try to remove it. Cover the burn with cling film or a clean plastic bag. Get rid of the first few centimetres. Place a single sheet over the burn and scrunch the edges, but don't wrap it around the limb. This protects it from infection. Always seek medical advice if your baby has a burn or scald. If the burn or scald is on the baby's face, hands or feet, or if the injured area is larger than the size of the baby's hand, or if it is a deep burn, then it's a serious burn or scald. Serious burns or scalds need emergency treatment, so call 999 or 112. While you wait for the ambulance, treat your baby for shock if necessary. So remember, move them away from the heat, cool the burn with water for at least 10 minutes, protect the burn with cling film, call 999 or 112 for an ambulance. And that's how you treat a baby with a burn or scald.
Baby starts to
Thanks
crawl,
for watching.
They can bump
Help
their head on
support St John
furniture
Ambulance.
or other objects, and falls are common. Most of the time the injury will be minor and they might not even cry, but sometimes a bump to the head can be more serious. If your baby has had a minor head injury, they may have a bump or bruise to the head and a wound, but they are still able to respond normally. If you think your baby has a minor head injury, sit them on your lap and hold something cold against the injury to help the swelling, like an ice pack or a frozen bag of vegetables wrapped in a tea towel. Do this for a maximum of 10 minutes. While you do this, try and assess their level of response. Are their eyes open? Are they alert? Can they respond to you if you talk to them? If they only respond to voice, they're drowsy. Do they only respond if you flick the bottom of their foot? Do they only respond to pain? Are they unresponsive to any of the above? If you are worried because they're not alert or because the injury is serious, then call 999 or 112 for emergency help. If they have any wounds, treat them by applying direct pressure to the wound and keep checking their level of response. If they've had a serious knock to the head, they may have a serious head injury and show some of these signs. They may be drowsy. They may have a headache. They may be dizzy. They may vomit. They may suffer a seizure or fit. There may be fluid coming from their ears or nose, and they may be unresponsive. If you know that your baby has had a severe knock to the head, or you notice any of these signs or think they're getting worse, you should call 999 or 112 for emergency help and tell them that you suspect a serious head injury to a baby. While you're waiting for help to arrive, try to keep your baby still in case they've suffered a neck injury. Check your baby's breathing and prepare to start CPR if they stop breathing. So remember, for a minor bump to the head, ease the pain and swelling with something cold and check their level of response. Treat any wound or bleeding if necessary. If you're worried or think it's a serious head injury, call 999 or 112 and keep checking your baby's breathing. Prepare to start CPR if necessary. And that's how you treat a baby who's suffered a head injury. When your baby starts
Thanks
to
for
crawl or
watching.
toddle around,
Help support
falls
St
are
John
common.
Ambulance.
Most of the time the injury will be minor and they might not even cry, but sometimes the fall can be more serious. Once you've carried out a primary survey, you need to perform CPR if they are unresponsive and not breathing normally. However, sometimes a fall can cause other injuries, such as a broken bone or head injury. If your baby has a broken bone, you might see some of these signs. They may look in pain. They may not be able to move an arm or leg.
There may be bruising or swelling. An area on the arm or leg may look deformed, bent, or shortened. If you think your baby has broken a bone, try to keep them still. Don't move your baby unless they're in danger. Then call 999 or 112 for emergency help. Support the joints above and below the injured area. Use your hands for this. Put soft padding around the injury for extra support. If necessary, treat them for shock by raising their legs, but don't raise the injured leg. While waiting for help to arrive, keep checking their breathing and whether they can respond to you. Sometimes a fall can cause a head injury. If your baby has a minor head injury, they may have a bump or bruise to the head and a wound, but they're still able to respond normally. If you think your baby has a minor head injury, sit them on your lap and hold something cold against the injury to help the swelling, like an ice pack or a frozen bag of vegetables wrapped in a tea towel. Do this for a maximum of 10 minutes. While you do this, try and assess their level of response. Are their eyes open? Are they alert? Can they respond to you if you talk to them? If they only respond to voice, they're drowsy. Do they only respond if you flick the bottom of their foot? Do they only respond to pain? Are they unresponsive to any of the above? If you are worried because they're not alert or because the injury is serious, then call 999 or 112 for emergency help. If they have any wounds, treat them by applying direct pressure to the wound and keep checking their level of response. If they've had a serious knock to the head, they may have a serious head injury and show some of these signs. They may be drowsy. They may have a headache. They may be dizzy. They may vomit. They may suffer a seizure or fit. There may be fluid coming from their ears or nose, and they may be unresponsive. If you know that your baby's had a severe knock to the head, or you notice any of these signs or think they're getting worse, you should call 999 or 112 for emergency help and tell them that you suspect a serious head injury to a baby. While you're waiting for help to arrive, try to keep your baby still in case they've suffered a neck injury. Check your baby's breathing and prepare to start CPR if they stop breathing. So remember, if your baby has had a serious fall, perform a primary survey. If your baby is unresponsive and not breathing, call for help and ask a helper to call 999 or 112 for emergency help. If you're on your own, use a mobile on speakerphone so that you can start CPR as soon as possible. If you do not have a speakerphone, do CPR for 1 minute before calling for emergency help. If you think your baby has broken a bone, keep them still, support the limb and call 999 or 112 for an ambulance and keep checking their breathing and level of response. If you're worried or think that it's a serious head injury, call 999 or 112 and keep checking your baby's breathing and prepare to start CPR if necessary. And that's how you treat a baby who's had a serious fall. Thanks for watching. Help support St John Ambulance.
If your baby is unwell and has a fever, it can be very worrying. If you think your baby has a fever, there are 6 key things to look for. Early on, you might notice a high temperature, above 37 degrees Celsius. They may have pale skin. They may feel cold, with goose pimples, shivering and chattering teeth. Then later, you might notice hot, flushed skin and sweating, a headache and general aches and pains. Take your baby's temperature using a thermometer. If it is above 37 degrees Celsius, it's a fever. Help make them comfortable and don't overdress them or remove too many clothes. Don't cool them down so much that you're making them shiver. Give them regular drinks. If they're breastfed, feed them regularly. And you can offer them water to drink. This will help keep them hydrated and replace any fluid they may lose from sweating. If your baby is distressed, you can give them the recommended dose of paracetamol. Remember, always check the information on the container and don't give aspirin-based medicine to anybody under the age of 16. Check your baby frequently, including during the night. If you're worried about their condition, they have a seizure or fit, then call 999 or 112. A temperature above 38 degrees Celsius is unusual under 3 months, or over 39 degrees Celsius above 3 months. Call for a doctor or NHS Direct for advice. If they seem to be getting worse, then call 999 or 112 for an ambulance and be prepared to treat them for a seizure. So remember, check their temperature and keep them cool. Give them plenty of fluids. If their temperature's over 38 degrees Celsius for a baby under 3 months, or above 39 degrees Celsius in a baby over 3 months, get medical advice. If they're getting worse, call 999 or 112. And that's how you treat a baby with a fever. Thanks for watching. Help support St John Ambulance. Donate today.
As you start weaning your baby, small items of food may get lodged in their throat and they may choke. They can also choke on small toys or household items. If a baby under 1 year old is choking, you'll notice that they'll be unable to cry, cough or breathe. What we're going to do now is administer some back blows. So first of all, you need to lay your baby face down along your thigh, making sure you support their head and their neck. Next, we're going to administer those directly between the shoulder blades using the heel of your hand. Give up to 5 sharp back blows, making sure after each one, whatever it is, hasn't come out. If the back blows don't work, we now need to move on to giving some chest thrusts. So we need to turn them over so they're lying face up, again making sure that their head and their neck are supported. Put 2 fingers in line with the armpit in the centre of the chest and pushing down sharply administer up to 5 chest thrusts. If this doesn't work, call 999 or 112 for emergency help. Repeat 5 back blows and 5 chest thrusts until help arrives. If they become unresponsive, you will need to start CPR. So remember, if your baby is choking, check the mouth, slap it out, squeeze it out. And that's how we treat a choking baby. Thanks for watching. Help support St John Ambulance. Donate today. Babies have lots of fun at bath time, but with any amount of water there's always a risk of drowning. As your baby crawls or toddles around, they may end up other places where there is water, such as swimming pools or lakes. If you think your baby is drowned, before starting CPR, move them away from the water and lie them on their backs, ideally on a raised surface such as a table. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's 1 rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. If your baby starts to breathe normally again, then we need to put them into the recovery position. Cradle your baby in your arms with their head tilted downwards. Then call for an ambulance. Keep checking your child's breathing, pulse and level of response while you wait for help to arrive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs, covering both the nose and mouth. Then 30 chest pumps with 2 fingers to the centre of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you give CPR to a baby that has drowned. Thanks for watching. Help support St John Ambulance. Donate today.
Cuts and grazes are common injuries that can usually be treated at home. A cut is a full break to the skin, whereas a graze is just the top layers of skin being scraped off. Normally, all you need to do is clean and dry the cut, apply some pressure and raise the injury. This should help prevent infection and stop bleeding. The wound should heal by itself within a few days. When treating a cut, always wear gloves if you have them, and first ask the casualty to apply some pressure to the wound using a piece of gauze. Just put some pressure on there and then raise the injury. Next, you need to clean the wound. And gently dry it. And finally, apply a sterile dressing. Just remove the gauze. Brilliant. Remember, apply pressure, raise the injury, clean and dry the cut, apply a sterile dressing. If you're worried about infection, ask the casualty to seek medical advice. And that's how we treat a cut or a graze. Parents often worry about their baby getting meningitis, and it can be very serious. Meningitis is a serious infection which affects the membranes that surround the brain and the spinal cord. Anyone can get meningitis, but babies and children under 5 are most at risk. Meningitis can be very serious and the baby may deteriorate very quickly. If you suspect meningitis, you must seek medical help urgently, as prompt treatment is vital. Therefore, it's important to recognise the symptoms. Your baby will be very unwell with a flu-like illness and high temperature. They may have blotchy or pale skin. Their hands and feet may feel cold to touch. They may have joint and limb pain. As the infection develops, they may have a severe headache, neck stiffness, vomiting, drowsiness. Their eyes may become sensitive to the light. They may have high-pitched moaning or grunting. They may be very floppy, and they may have a tense or bulging soft spot called the fontanelle on the top of their skull. Later, you may see a distinctive rash of red or purple spots that doesn't fade when pressed. But meningitis can still be the cause of severe illness even if they do not develop a rash. It is unlikely for all of the symptoms to show at the same time, but if your baby is very unwell, do not wait for all of them to appear. If you are worried, seek medical advice straight away. If they have a fever, you should treat it. Keep monitoring your baby, check them for signs of a distinctive red or purple rash which does not fade when pressed. If you see a rash, perform the glass test. Press the side of a glass against the rash. Most rashes should normally fade. If the rash does not fade, you should call 999 or 112 for emergency help straight away, as this is a sign of a later stage of meningitis. While you're waiting for help to arrive, keep your baby cool and reassure them. Keep checking their breathing, pulse, and whether they respond to you. So remember, if you suspect meningitis or notice any worrying signs, seek urgent medical advice. If they have a fever, treat it by keeping your baby cool and comfortable. Check the baby for a rash and call 999 or 112 if you are worried. Keep checking their breathing and level of response. And that's how you treat a baby who you think may have meningitis. Thanks for watching. Help support St John Ambulance. Donate today.
The greatest risk is their spinal cord may be temporarily or permanently damaged. If a casualty has suffered an abnormal force to the neck or back and is complaining of changes in sensation or difficulty in moving, they could have a spinal injury. You must take care not to unnecessarily move their head, neck or spine. Some of the following incidents could indicate a possible spinal injury. They could have fallen from a height, such as from a ladder, fallen awkwardly when doing gymnastics, from diving into a shallow pool and hitting the bottom, a collapsed rugby scrum, fallen awkwardly from a horse or motorbike. They could have experienced sudden deacceleration in a car, had an injury to the head or face, or had a heavy object fall across their back. If you suspect someone has a spinal injury, there are several key things to look for. They may have pain in their neck or back where the injury occurred, have bruising and tenderness in the skin over the spine, an irregular twist in the normal curve of the spine, have breathing difficulties, loss of bladder and or bowel control. They may lose control of their limbs, may lose sensation or have abnormal sensations such as tingling or burning, or their limbs feel stiff, heavy or clumsy. If you think they have a spinal injury, reassure the casualty and advise them not to move. Call 999 or 112 for emergency help. You should then kneel or lie behind the casualty's head. Rest your elbows on the ground or on your knees to help keep your arms steady. Hold each side of their head with your fingers spread so their ears are not covered and they can still hear you. Support the head in this position so the head, neck and spine are aligned. While you support their head, ask a helper to place rolled up blankets, towels or clothes on either side of the casualty's head. Make sure you continue to hold this position until emergency help arrives. Do not move the casualty from the position that you have found them in unless they are in immediate danger and it's safe for you to do so. Monitor their level of response until help arrives. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, if you suspect a spinal injury, reassure them and call 999 or 112. Don't move them. Support their head and neck until help arrives. And that's how you help someone with a spinal injury. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
A seizure, also known as a convulsion or fit, can be caused by raised body temperature linked to throat, ear or other infections. It can occur because the brain is not mature enough to deal with the body's high temperature. When a child is having a seizure, you may find they have loss of or impaired response, vigorous shaking with clenched fists and an arched back, signs of a fever with hot, flushed skin and sweating, breath holding and red, puffy face, possible vomiting, or a loss of bowel or bladder control. If you think your child is having a seizure, place pillows or soft padding around the child so they don't injure themselves on surrounding objects. Do not restrain them. If they have a raised body temperature, try and cool the child by removing any bedding and clothing, although you may have to wait until the seizure stops to do this. Ensure there is fresh air, but make sure the child doesn't get too cold. When the seizure has stopped, open the airway and check their breathing. If they are breathing, put the child in the recovery position. Call 999 or 112 for emergency help. While you wait for help, reassure the child and monitor their level of response. So remember, place padding around the child and don't restrain them. Try and cool them down. When the seizure has stopped, open their airway and check their breathing. If they are breathing, put them in the recovery position and call 999 or 112 for emergency help. And that's how you help a child having a seizure. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
If you know what to do, you'll give them the best chance of survival. If something has happened to your baby, you'll need to do a primary survey. This is a quick, orderly way for you to find out if your baby has any injuries or conditions that are life-threatening. You should always perform a primary survey before treating your baby because it will help you find out what's wrong and the best way to help them. We can use the initials DRABC or Dr. ABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. To perform a primary survey, first you need to ensure there's no danger. That means nothing near the baby that may cause further harm to them or to you. This is to avoid any injury to you and to prevent you from becoming a casualty as well. Look around quickly and make sure it's safe to approach. If you see any danger or anything hazardous nearby, clear it away quickly. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is not breathing normally, ask a helper to call 999 or 112 for emergency help. If you're on your own, use a mobile on speakerphone so that you can start CPR as soon as possible. If you don't have a speakerphone, begin CPR for 1 minute before making the call yourself. If your baby is breathing normally, check to see if they are bleeding. This will enable you to stop blood loss from the circulation. Try to treat and control any severe bleeding. If your baby is not bleeding severely, place your baby in the recovery position. Just cradle the baby towards you in your arms with their head tilted downwards. This will help keep your baby's airway clear and prevent them from inhaling any vomit. Keep monitoring their breathing until help arrives. If they stop breathing, open their airway and start CPR. So remember, do a primary survey to try and find out what's wrong as quickly as possible. We do this by checking for danger, check for a response, open their airway and check their breathing. If they aren't breathing, call for help, ask a helper to dial 999 or 112 for emergency help and begin CPR. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. If they are breathing normally, check their circulation, check for severe bleeding and treat if necessary. If there is no severe bleeding, hold them in the recovery position until help arrives. If they stop breathing, open their airway and begin CPR. And that's how you perform primary survey on a baby. Thanks for watching. Help support St John Ambulance. People may faint as a reaction to pain, exhaustion, hunger or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away. And if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sjA.org.uk/donate.
Fingers and hands can easily get stuck in small spaces. Sometimes they may get hand or finger injuries such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender and there may be swelling or bruising and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. ICE. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding like cotton wool around the area. And elevation. Keep your baby's arm raised with something soft like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you could give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ICE. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms. Thanks for watching. Help support St John Ambulance. Donate.
If you think someone has had a head injury, there are 6 key things you may find. They may have become unresponsive, even for a short time. There may be a scalp wound. They may complain of dizziness or nausea. They may have memory loss of events at the time of the injury or before the injury occurred. They may complain of a headache. They may be confused. If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess the level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are the eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain if you pinch the earlobe? Do they open their eyes? U, are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head whilst playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise them to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they have been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Headaches are not usually serious and can be treated at home. Common causes include tiredness, stress, an illness such as flu, or exposure to hot or cold temperatures. But headaches can be a sign of a more serious problem, like meningitis, head injury, or stroke. If someone has other symptoms, or it's following a blow to the head, be sure to seek medical advice. If someone has a headache, help them to lie or sit down in a quiet place and give them something cold to hold against their head. This could be a cold compress, it could be an ice pack, or a bag of frozen peas wrapped up in a cloth. Be sure not to leave it on for longer than 10 minutes. For adults, you can suggest they take the recommended dose of painkillers such as paracetamol. For children, you can give them the recommended dose of paracetamol syrup. If someone has other symptoms such as fever, vomiting, a stiff neck and sensitivity to light, be sure to seek medical advice immediately. Or if they become unresponsive, call 999 or 112 for emergency help and prepare to treat an unresponsive casualty. If they have a headache following a head injury, if the headache is not settling or their condition is getting worse, they should also seek medical advice immediately. Remember, get them to lie or sit in a quiet place. Help them to take the recommended dose of painkiller. And if you are concerned, seek medical advice. That's how we treat a headache.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs: pain in the chest, which could spread to the jaw, neck, or arms; breathlessness, discomfort in the stomach similar to severe indigestion; collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 milligrams, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become unresponsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 milligrams of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/.
To bandage somebody's hand, use a roller bandage. Place the bandage on the inside of the wrist, just below the thumb. Wrap the bandage straight around the wrist twice. Then wrap the bandage from the inside of their wrist diagonally across the back of their hand up to the nail of their little finger, straight across underneath the fingers, and diagonally back across the back of their hand to the outside of their wrist. Pass the bandage under their wrist and repeat, diagonal over the back of the hand, across the fingers, and back again. Keep going the same way, bandaging diagonally across the hand like a figure of 8. But each time, only cover about 2/3 of the previous layer. Each new layer should be covering 1/3 of new skin. Make sure you leave the tips of their fingers peeking through. Once you've covered the whole of the hand, wrap the bandage straight around the wrist a couple of times and secure with a pin or tape. To check the circulation, squeeze the fingernail for 5 seconds. When you let go, if the colour doesn't come back within 2 seconds, it means the bandage is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, when applying a hand bandage, use a roller bandage. Make sure the bandage extends far beyond the injury